remember when all that was going down, I think I was about to start my round of an IVF again. Like I was going to do IVF again with Dr. Beck. And the thing about Dr. Beck that is incredible is that she really did spend time on my body and like really kind of explored it. And she said, okay, let's do a round. So I go into my 4th round of IVF, and she was very adamant that she's like the lead follicle. And I'm not going to be scientific. I'm sure she would like.
So far, you're doing great.
Okay, great. So the lead follicle is usually the follicle that produces the healthiest egg. And she said, based on like my body chemistry or however it is made up, that you need to trigger early because they can over ripen really quickly. And so she, as opposed to the last doctor who let me grow to 24 to 27 millimeters, she was like, the second you get to 16 or 17, I'm going to trigger you. And I got really sad because I had all these other little follicles behind that I desperately wanted to catch up, and they were growing, but slowly. And I was like, but if we trigger me now, those aren't going to be mature enough. And I'm going to lose all these numbers. Because in my head, I was still so obsessed with the numbers. Only 1 out of 10 is going to be viable. Like only one at that point I was 40. So I was so desperate to like not lose, the numbers. Cause I thought, what if one of those are viable? And Dr. Beck kept repeating something. She's like, it's quality over quantity. It's quality over quantity. And you always hear that saying, it only takes one. And I hated when people said that to me because I was like, yeah, but I'm not getting any. So like, I understand it only takes one, but what if one doesn't stick? What if one doesn't work? What if I can't even get one? And I became so obsessed with this idea that I needed lots. Like I needed to have a lot because a lot of my friends were getting anywhere between 3 to 10 embryos doing IVF, who were even in some of my same age range. And I kept comparing myself. And I know it's like compare and despair, but I couldn't help but compare myself because when you're going on a journey and other people are going on it too, and you're watching it work for other people, it goes back to that, mentality for me where I was like, well, it's not going to happen for me. So for the first time ever, I got a blastocyst with Dr. Beck, and I was over the moon, and I couldn't believe it. And it was so exciting. And then they tested it, and it had an abnormality, and I was devastated again. And that's when Dr. Beck called me and was like, I'm very, very certain that you have endometriosis. And I go, what? Like, first of all, I had painful periods, but nothing that I felt was any different than normal people complaining about their period cramps. And then she kind of explained to me that it kind of is this sort of hidden secret disease that women struggle with. And I remember you and I had talked about it, and you even asked me point blank, do you have endometriosis? I think, because I had some inflammation markers, and I was like, no, I feel like somebody would have diagnosed me with endometriosis. I always regret this because had I just stayed with Dr. Beck and not gone from doctor to doctor to doctor.
Don't forget the quarantine.
And
you didn't make the decision to leave her. The
That's
quarantine
true.
Made the decision to go where you could go.
Had I just waited and gone back when California
There was
fertility,
no way for you to know that. There was
Yeah.
no way for you to know what to do then.
Dr. Beck recommended a handful of doctors. One in particular is Dr. Najat. Am I saying that right? Dr. Najat?
Yeah, Cameron Najat.
Cameron Najat up in Palo Alto. And she was like, and I at this point trusted Dr. Beck so implicitly that she said, would you consider going up there? I'm going to call him for you. I'm going to make a call. And I said, sure. The office called me after Dr. Beck called the office within, I think, 10 minutes. And I made a flight up to Palo Alto for 5 days later. And I just flew up there. And I was like, I remember walking into Dr. Najat's office, and his walls are lined with baby photos, just like nothing but baby photos. And I remember he said to me, he's like, these are all women who thought they could not have children. He's like, you're going to send me one of these baby photos.
He also makes a joke that they're all named Cameron.
Oh, really? By the way, I contemplated it. And so I just remember being like, whoa, like, okay, sure. And I remember I still felt a little bit like, all right, but I'm going to be the person that doesn't send you this baby photo. Like, watch me do it. And I got like so devastated and sad about it. And I remember it's really hard because you can't get diagnosed with endometriosis. It's like they have to go in and actually like do surgery to see if you have endometriosis. It's a very strange thing where science hasn't quite caught up yet, where you can I think I showed signs.
Well, the diagnosis and the treatment are the same.
Yes.
That when they're treating it, they're seeing it, and then pathology confirms it of what they excise from your body.
Completely. And So I basically, he said, I had a cancellation in 6 weeks. Do you want to come back out here? I think this is now July of 2022. He's like, do you want to come out here and have the surgery? And I said, sure. I was like, absolutely. And I will say, in case people don't know, because I was like, he basically was like, okay, I'm going to like enter you now to see if I can move your organs. And I was like, okay, sure. And then all of a sudden multiple nurses came in, because I think like he's very, very methodical, and like is like, hey, everyone's here. I'm doing the proper thing. And he basically tried to go into me and move my organs. And he was like, they're really tight. It seems like you probably do have endo. But again, there's no way to really know until they do the surgery. So I booked this surgery. I did all the prep, and it's like scary. I didn't really understand what was going to happen. I knew it was laparoscopic. I knew I was going to have 4 different incisions. And I just remember waking up after the surgery was over. And Dr. Najat is the kindest, most wonderful human. I can't explain it. He just is very calm and like loving and easygoing, and is like, we're going to take care of you and you're going to have a baby. And I'm like, okay. So Dr. Najat, I remember I did the surgery. I wake up. He probably had like so many patients that day. So I didn't see him after I woke up. And I remember I turned to the nurse and I was like, did I have endometriosis? And she's like, the doctor's going to call you. And I was like, okay. And then, they're like, okay, you need to now go and, to try and urinate, try and do these things. And I was like so out of it. And I remember they were trying to like get me out, and they're like, your husband's coming to pick you up. Don't you want to see your husband? I was like, no, I see him every day. Like, let me just lie in this bed. Like, I don't want to leave yet. And I was also so scared, because I was like, what if I didn't have endo? And I think I was like waiting to hear from the doctor. And then I ended up going into the car, and Dr. Najat had called Jack, my husband, after the surgery. And I had endo all over my ovaries, my uterus, my cervix, but primarily it was on my ovaries, which is where my eggs were coming from. I also had a uterine septum wall, which was in the exact spot where something like 90% of all implantation happens. And that if even an embryo I had gotten pregnant on my own.
With a normal embryo.
It would have landed shot right out. And you cannot see it unless you do the surgery. Like, it was not visible on an ultrasound.
So it was a small divot.
Yes. Mm-hmm. And in an area which it would be impossible for them to see. So when they went in there, I had just a plethora of reasons why I've been having so many fertility challenges. And I remember I talked to Dr. Beck, and Dr. Beck was like, this is like, I knew it. I had a hunch, and I was right. And it's not even a hunch at this point. Like, she's a scientist. Like, she knew. She kind of looked at the all the different things I had gone through and was like, I think you have endometriosis. I'm almost positive you do. And I did. And I feel like everyone who she's ever said this to has all turned out to have endometriosis, every single one. So at a certain point, I don't know why people aren't talking about this. No other doctor, not a single, I had been at that point to 3 other doctors. No one had even hinted at endometriosis.
Mm-hmm. That's the struggle right now. Like, I can detect it too, having had a laparoscopy now 3 times.
Right.
Once in college, once 2 years before conceiving Kira, and then once in my postmenopausal following exposure to COVID antibodies. And the old, whatever was left that the second lap hadn't got, that was hidden behind my uterus, whatever was remaining was activated for some reason.
Yeah.
But I know a lot about the procedure. I know a lot about the illness. I've created the Holistic Guide to Healing Endo course inside the SEED program that supplies women with a lot of information and 10 expert videoed interviews with Dr. Beck, Dr. Najat, the Orbucks, leaders in the field, so that the women don't have to spend the money to go and have those discussions. They can watch these videos and get a sense, do I have reason to suspect endo enough to try to pursue it with my doctors? And then it tells them what to do to recover from the surgery, what's going on in the surgery, and how to move forward after having surgery if fertility is the goal.
Yes. And I just like this, you, Dr. Beck, Dr. Najat, like you guys changed my life. Also too, if I had not even wanted to pursue fertility after this, I didn't have painful periods anymore. And I didn't realize how painful my periods were. I didn't realize how much pain I was suffering through each month, just thinking that's being a woman.
Yeah. You don't even know like how your face has changed. There were eye circles that you used to have. You don't even have them now.
Well, that's because I also can now, do Botox and use different type of facial products. I'm no longer trying to have a baby. But yes.
Well, I'm just saying, like when we are in pain, it shows up on the face. It shows up in the pelvis.
Yes.
And
I didn't even quite realize that, and you had hinted at it. You had asked me and I was like, no, I definitely don't have endometriosis. Like why? No one had told me up until this point. And I think it wasn't until I started having like fertility challenges that I even started to look into it.
Yep. So Dr. Nijat says in his interview, it's not pain that drives him to do this work. It's unexplained infertility.
Yes.